Okay, I think we're ready to start. So if you'd all like to turn your cameras on, please, that would be lovely. So we can see everybody, that's terrific. Um, I do just want to say hello, everybody. It is really good to see you again. I think we'll all agree we're in very worrying times. Hounslow has the dubious honour of being the highest COVID, with the highest COVID rates across London. We need to stay at home. Our message is clear. Now is not the time for complacency. Infection rates may be coming down, but they're still far too high. The NHS remains under intense pressure, and many Londoners are sadly losing their lives. So I'm really pleased today that we've got such an informed panel with us, and they're giving up their time, obviously when things are tough out there. So I do really appreciate that. So first up is Mark Titcomb, the director of West Middlesex University Hospital, which is mine and Alan's local hospital, and it's truly wonderful. But thank you very much, Mark, for giving up your time to be with us. Would you like to take the floor?
Thank you, Sally. Good morning, everyone. Mark Titcomb, the hospital director from West Middlesex Hospital. I'm delighted to be with you this morning. I was just going to give a short sort of snapshot and update on where the hospital is at the moment and a few other points. So to give you a feel, we've got just under 200 COVID inpatients at West Middlesex this morning. And that's the first time for the last 2 weeks when we've just edged under 200. And again, just to put that in context, at the moment we have about 360 inpatient beds, which aren't maternity or paediatric. So that just gives a bit of a feel for the level of activity here at the moment. And obviously we have all those other beds full with non-COVID patients at the moment, which is some of our normal winter activity that you would expect. Again, perhaps just for context, during phase 1 in March and April, we had just over 150 inpatients, COVID inpatients. So we're about a third, 33% busier than we were during phase 1. And in terms of our intensive care capacity, we vary a little bit because obviously patients move in and out of intensive care and sometimes we transfer them. But we have normally between about 25 and 29 patients in intensive care at the moment at the hospital. And we expanded our facilities for intensive care a lot over the summer period to make sure that we were ready for this phase. So our nominal intensive care capacity is 9 patients. We have the capacity at the moment to go up to 31. So we are just within that and managing that at the moment. To give a feel in terms of the activity at the hospital, I would say that we are just managing with the admissions at the moment and just coping well, but just within our limits. We've had to convert some of our escalation areas, which we normally do during the winter period, to cope with that influx of patients. I think the good news is that we're offloading ambulances safely and well at the emergency department front door. And we're not having any delays on that. We've had a couple of minor delays a couple of weeks ago, but nothing major there, which is good and providing that good service, or as good a service as we can. We've also been able to help out some of our fellow hospitals. So that's Ealing, Hillingdon and Northwick Park over the last month or so, where when the pressure has got particularly great at one of those, we've been able to accept some of their patients and in some cases some ambulance diverts. And what that does mean is that we have probably a slightly greater mix of patients within the hospital at the moment, some of them from outside of Hounslow and Richmond, our more traditional areas. In terms of discharges, which is really key to maintaining a safe hospital at the moment, we're very fortunate here to have a really dynamic discharge team and hub working within the hospital, and that comprises of some hospital staff, but also our community, our commissioning group colleagues, some of our local authority colleagues, social services, and indeed some volunteers as well. And we've also had some of our local GPs reaching into the hospital to make that really work well. And I think the way that has operated, particularly over the last 2 months, has ensured that as soon as patients are medically optimised and it's safe for them to return home, wherever that home is, then we're able to quickly and swiftly discharge them from the hospital. and that's been a real success over the past, as I say, over the past couple of months, and helped us maintain the hospital running within its capacity. You know, huge support from our colleagues with that. In terms of our staffing, people always ask quite rightly about how are our people and how is the staffing going. Obviously, a lot of pressure, particularly early on with some sickness, and making sure that we had to stretch staff and move staff to make sure all the areas that we have open are covered. That pressure has eased a little bit recently, but it continues, particularly obviously staffing that intensive care unit that I mentioned up to that number of patients, which requires a high number of staff. Certainly in terms of using some of our volunteers, using some of our colleagues who normally work in other areas of the hospital, perhaps in finance or in IT, to actually pick up some of the other roles, which then enables our frontline staff to absolutely focus on those most important areas. So we've had to be very flexible about how we use people throughout. And equally, we've worked very well with our fellow hospital over at Chelsea to make sure that we're, you know, using the people that we have available, and if necessary, we can move patients from one hospital to another, or indeed we can move staff from one hospital to another to make sure that we can safely staff our hospitals. And I have to say we've had some fantastic local support as well, from voluntary organisations, from the community and from businesses as well, in terms of helping to provide some of those small things which have gone down really, really well at the hospitals, particularly around some of the extras around food and drink and things during the really tough times, which has been excellent and really well appreciated by the staff. Sometimes people just ask about our other activity and how are we managing to maintain that. We have had to reduce our what I call our normal activity, so some of our outpatient activity, some of our theatre activity, and some of our diagnostic activity, particularly over the past couple of months. I think the good news here is that we haven't had to reduce it anywhere near to the same extent as we did during the first phase. And again, just to give a bit of a feel, we're running about between 60 and 70% of our normal diagnostic activity. So we are able to bring patients, particularly urgent, time-critical patients, certainly our cancer patients, in for their diagnostics and in for their surgery if they need it. And when we've worked really hard to maintain that. And I think as we see, hopefully over the next few months, the COVID numbers begin to decrease, then we're in a very good position to pick that back up and to really get that aspect moving as quickly as we can, which is good. A couple of ones just to finish with. In terms of the sort of, people always say, well, what more can I do? Is there anything else that can be done? I think the message is West Middlesex is very much open for business, but it is very pressurized. And so I think following that national advice around where to go, using the other services that are available, and using the hospital when it's appropriate is very much the message there. And I would just say a little word about visitors as well. Obviously visiting, we're following the national guidance on this. Visiting at the moment is only permitted in very particular circumstances. So for example, for some of our end-of-life patients, some of our patients with dementia or learning difficulties, paediatric patients who need support. And that is both a difficult message for families and also a very difficult message for staff to have some of those conversations. And obviously visiting patients who are on ventilation or on non-invasive ventilation is very, very difficult to arrange and to do. So support with that message and understanding, I think, and some of those conversations is much appreciated from the hospital's perspective. Hopefully that's given an overview. I'll stick around and hopefully be able to take any questions later on. Thanks very much.
Thank you very much, Mark. I do just want one quick thing, because you might have to dash off. Am I right in thinking that the Nightingale hospitals, that if you want, as a hospital, wanted to use it, if you sent a patient there, you also had to send staff? Is that how it worked?
We are always looking to see whether we can make use of that facility. We have identified 1 or 2 patients to transfer to the Nightingale. We haven't had to provide staff for those, Sally. So at the moment that's being staffed from elsewhere, but I think they have drawn from other London hospitals, yes.
Right, okay. Thank you very much for that. Thank you. And I'm sure there will be questions for you, hopefully. And if you have had to go, I will forward them on to you and to Stephen. Okie dokie. We next have Kelly O'Neill, Director of Public Health from Hounslow Council. Kelly, over to you.
Thanks, Ali, and thank you for inviting me this morning. So I'm Kelly O'Neill, I'm the Director of Public Health for the borough. Picking up on where Mark's left off, I think sort of just the important thing to note is that sort of high rates of infection means more people are hospitalised. Unfortunately, it means more people die. So that's the sort of the big statement, and if people remember that, that sort of gives you a sort of a view of why getting our rates lower is so very, very important. Our rates are very high at the moment. So at the moment, we are joint first in London as the highest borough. I can't explain why that is the case. Above and beyond it, maybe it's social and economic, with a lot of people who live in our borough who are still key workers. We're starting to work with Public Health England to review our data and to look for sort of an objective view as to what we may not be seeing in the data. My view is that it is probably due to sort of social and economic and the demography of our populations, because of the high rates appear to be 3 of the boroughs in northwest London are in that sort of group of the top 7. So we do need to work together to reduce that. It is important just to say, as I said, first of all, is that while you do have high rates of infection, you will get more people infected, and you will get more people who do end up in hospital. And what Mark is talking about in terms of the slight reduction in the number of cases that he's seeing, it very much reflects a sort of a bit of a time lag in terms of a very, very slow response to the impact of the lockdown. So other areas are seeing a much more rapid decrease in the number of cases. We seem to have a very, very small decrease. So and looking at sort of the data today, it's about 731 cases per 100,000. That's still sort of well in excess of 2,500 people in the borough who've tested positive. And the rates of infection that we record are very much based on people actually presenting to get tested. These rates do vary, and we do look for patterns, and the pattern is, as I say, a very slow decline. So it's not like what we saw after the March lockdown, where it was quite a rapid decline. So we will sort of catch up with other areas, but it will be slow. And the important thing to note about it being slow is it will still result in hospital sort of admissions. So we'll see a long protracted acute use of our hospital for some time, unless we can get real focus on getting this rate down. What is important and probably good to know is that our case positivity rate, so that's the number of people per 100 who are being tested, who test positive, and that really gives us an idea of how many people sort of the likely amount of infection that's transmitting in the borough. Now, we have been up to a case positivity rate of about 30%, which just sort of shouts out to us that there's lots of people who aren't getting tested. So that means that lots of people within the community are either symptomatic and choosing not to get tested, or one of these 1 in 3 who are asymptomatic, who will be infected, won't know they're infected, but certainly will be showing around infection. But our case positivity as of today is below 15%, so it's 14.8%. If we can get down to 5%, and most of London is above 8%, we can have a really sort of a very accurate view that actually we're picking up most of these cases, but at the moment it's still a bit high. So obviously, as Mark's has spoken about the sort of high amount of activity in the borough, just to put it in context of deaths, and just recognise that is that if you look back over December, when our rates were creeping up after the sort of lockdown 2, because of that sort of delayed sort of pathway of care from identifying that you're getting symptoms, identifying you're testing positive, to requiring hospitalisation. So our deaths in December were 53. So far in January, we're more than 130 people. So it's really incredibly important. We knew this was going to happen, but you know, by the time that you'll start seeing these rates increase, you already know that that sort of momentum of activity is already in place. So where are we seeing this? Oh, I suppose, you know, lots of things contribute to this. What we see is rapid transfer or rapid infection transmission within houses. We know that not everybody is following the rules, because we see households which are clearly linked to each other developing symptoms, and a sort of a series over a few days of people testing positive. So we know that's happening. There are certain sectors in our community where this new variant that we know is much more transmissible, and you know, just to sort of give an idea of what the percentage of cases are that are this new Essex variant, it's roughly about 77% of cases are within this kind of Essex variant, which is very, very transmissible. So what we're finding is that with routine testing in, say, care homes and well, care homes predominantly, we are seeing quite a significant spread of infection even before we get the results back. So, you know, the importance of having very, very tight infection control within these settings is incredibly important. And given where we were after the first wave, where given where we were after the first wave, where we had the lowest number of excess deaths, and actually our outbreaks in our care homes and the number of people that were affected in care homes was really low, it's a very different scenario. But this is not just Hounslow that's experiencing this. This is across London and much wider. So outbreaks are occurring all over the place. They all need a big incident response, a big outbreak control response. So care homes, we've had that in schools, but to a lesser extent in schools. Obviously, schools aren't operating now, so we are seeing sort of this impact of schools only having key worker staff. Although I do hasten to add, the number of children in schools is still high, because, and you know, essentially because the guidelines allow for that to be the case. We have had outbreaks in prisons and youth offending institution, and a lot of outbreaks in workplaces and businesses. So areas where people congregate on a regular basis, we do see outbreaks. And it, most of the time, you know, people are following the rules, sort of hands, face and space. But I think many people are fatigued by this. And just every so often, I think that people suddenly let their guard down. And actually, when you're dealing with a virus, you can't let your guard down. Like somebody said something that was really important the other day as well, is that when the council or when the borough put forward a bid to be the borough of culture, one of the key things we advocated is how well connected the borough is, which is great for a borough of culture, but it's not great when you've got a pandemic. So in terms of our response, so key is identifying cases. So what we've got in place is the standard PCR testing. This is the testing that drive-through and walk-through that the Department of Health have put in place. We've still got Twickenham operating, Heathrow operating, and 3 sites in the borough. So 1 in Feltham, 1 in Heston. Actually, we do have the one in Hounslow Central, and a new one will be coming live this week, just in Chiswick. So we're testing about 14,000 people a week, which is huge given where we were about a month ago. That's 3 times the number we're testing. And we've recently introduced this rapid lateral flow testing, and there are a number of community settings that we have this locating from. So Hounslow House has a testing centre, Heston Library, Wellington Day Centre, and there's another one, Isleworth Library, and we will go live with another venue in Feltham this week. In addition, we have some roving mobile testing units which are going to various businesses. So I would contact the public health at hounslow.gov.uk if you are a business that would like to have a testing unit come to you. It allows us to identify people who are symptomatic, so it's not for people who are symptomatic. And we are picking up a number of cases through that route. We've also extended it out through all of our schools, so secondary schools, and as of this week, primary schools and early years will go live with rapid tracing. And that's a really positive thing. While the test isn't perfect, it does allow schools to be on the front foot, because certainly last term it was constantly a reactive response to cases in the school, and the impact was quite widely felt. They are changing the guidelines for testing though, so it's going to be routine twice a week testing of schools, but they won't. The Department for Education has paused this kind of serial 7-day testing that it had previously said it was going to do. In addition, once you identify someone is positive, this all gets logged with a national track and trace team, and they then follow up people who test positive, trying to identify who their contacts are, whether they need support, and to be clear about whether they are isolating. Now, in the borough, much like pretty much every other London borough, we're doing what's called enhanced contact tracing. So anybody that they don't identify through the track and trace team, who they're not contactable, we will follow up, and we will follow up to provide support and to assure ourselves that people are isolating. What we do find is that many people don't answer the phone, and that can be incredibly frustrating. But we are increasing the number of times that we are knocking on people's doors just to check. In terms of our priorities, I mean, clearly the number one priority is to protect lives. And I think Mark has set out that there is a lot of work in order to respond to this increased number of cases. A lot of work on outbreak control within the community, and providing a safe environment for people to be cared for in the community. Working with sort of various community groups in order to ensure that people don't congregate. So many of our places of worship who are allowed to be open have voluntarily temporarily shut, which is a really, really positive approach to supporting the community. There's a lot of communications, and we have ramped up the way that our communications have been very direct. So some people will be pretty angry with the way that we've been very direct, because we have stated the number of deaths, because it is really a call to action. If that's what resonates with people, then that's the messaging that we will use. I think Graham and Lisa will, or Mel will talk about enforcement. I'll leave that to them. They're experts on that. And I suppose the last thing to mention is the big ticket. The big ticket intervention is vaccination. And I can say that roughly about 75% of our over 80s are vaccinated. And we will complete, or we will, if the supply of vaccine still keeps coming to us in the way that it has, we will complete all of those people in the 4 priority groups by the middle of February. So that's a really positive. So I would encourage our older residents, anybody who works in health and social care. It's really important that you get vaccinated. The more people that we can get vaccinated, the more we'll reduce the amount of activity on the hospital, and the more people will recover and stay well. Okay. That's me over.
Thank you very much indeed, Kelly. And also, yes, just to let you know, my brother-in-law, who's at that risk group, is in Chiswick. He's just received his invitation to be vaccinated. Good. So the system the weekend, so we're all very pleased about that. So thank you. A quick one about the businesses and testing, the asymptomatic testing. Yes, Hounslow Chamber, we have been working with the council, and all businesses with over 50 employees we put in touch. And yes, I think Russell Finex in Feltham actually had the mobile testing unit out there, which is great. So any other businesses interested, please do let me know. I'll put you in touch with Kelly's team. Right, we now have Mel Bruneau, who is our health and safety hard the past since.
Okay, thanks, Sally. Yeah, as Sally said, it's Mel Bruneau, the Health and Safety Director for Hounslow Chamber of Commerce. And yes, spent some time working with some of our COVID marshals. I'm just going to share my screen because I have just got a little PowerPoint, just because there's so much to think about with this, and I don't want to take up everybody's time more than I have to. And if anybody's got any other questions, they can just come back to me on them. Okay, so Kelly's covered some of this, and I think Mark also mentioned this. Okay, where we're currently at, we all know the guys have covered this so far. Yes, there are new variants to the virus, but Kelly also touched on this just slightly. Is there a level of complacency? Are people now struggling because we've been through this so many times? Are they struggling to understand what they should be doing, what they shouldn't be doing? So therefore, are they not doing anything at all? Are they overwhelmed with the amount of information that they're getting? On an individual level, I think we all try to do our bit. On a business level, my main focus is in cargo and logistics, which is obviously classed as key workers. We've still had stuff move in. And we see that the businesses try their best, but there's also this thing with the congregating, and Kelly touched on it, where you've got people that congregate and they can't socially distance. How are we going to manage that? So we have to think about what we're going to do and how we're going to manage the concept of being COVID secure. How does the virus spread? Let's get back to basics. Kelly touched on it again. We've got the hands, the face, and the space message that comes out all day, every day to us. But I think when we start talking from a business point of view, there are additional things that we have to think about. Individually, we can all manage this at home. How do we manage it in the workplace? Because we go into work, we still want to be safe. The Health and Safety at Work Act, 1974, says that we can go into work and we be safe and go home in the same condition. So from a business point of view, how do we continue to make that happen? You have to look at your business. You have to decide if there's additional measures. And the way you do that is through a risk assessment. Now, many small businesses have struggled with this because the Health and Safety at Work Act actually says if you've got 5 or less employees, a lot of these rules don't really apply to you. It's guidance only. So you may never have done a risk assessment before. But we've had some great guys out in the streets of the borough working with the businesses, looking at risk assessments, supporting them. And I'll come on to that engagement in a bit. But just really to think about 3 things we all know about the hands, the face, the space. But the 3 things to think about from your business point of view is the 3 C's: closed spaces, crowded places, and close contact settings. So where there might be a closed space with poor ventilation, crowded places and many people nearby, we call them our pinch points within the borough, but those pinch points could be within your business as well. Close contact settings, close range conversation, the canteens, the restrooms, the kettles, the toasters, the microwaves, or vending machines, or even just down to the shift changeover. We have to try to look at all of these things. And that's what your COVID risk assessment would do for you. There are loads of templates available, or there's always our fantastic guys at the chamber that can point you in the right direction, that can provide you with that support for a risk assessment. And I would encourage all of you, whether you've got 1 employee or 5 employees or 50 employees, to focus on a risk assessment. That risk assessment will refocus your brain. We all do them on a daily basis. Okay, we don't open our car door without doing a risk assessment. We just do it naturally. We're focusing on, is there a car coming? Is there a cyclist coming? Is there a pedestrian there? You're not going to open the door on them. That's a risk assessment. That's how simple it is. Looking at the hazards, what can we do to reduce that risk? We have to now look at the businesses, as Kelly quite rightly said, this crossover, these mixing of households. It's focusing on how you can stop that contamination, that transmission of that virus. And it goes from people to people, contact to contact. And that is what we need to try to eliminate. Now, stopping it at the door may be your only possibility within your business. You may look at your business and go, do you know what? We can't do social distancing. I can't stop this happening. We have to have this. We're a key working business. And like I say, we see it in cargo and logistics all day, every day. If anybody's watched how we load the pallets, how we load the aircrafts, sometimes there's not the ability for that social distancing. You're going to meet the 3 C's. So how are you then going to manage that? We've got to stop the virus getting in the door. So things like temperature checking of staff. It's not something that is common across every business that I've been into in the last 9 months, but I can guarantee you the ones that are doing it and are picking up on those that are potentially coming into work purely because they're too scared they're now not going to get paid. We have to understand that this has now been going on. And Kelly touched on, we had that rapid drop in the first lockdown, which we're not seeing this time. And from what I'm seeing in businesses, yes, there is an element of complacency, but there is this element of, I need to go to work, even if I feel a bit poorly. And there's also, oh, it's the winter. I always get a bit of a cold in the winter. I'm just feeling a bit run down. I've just done a week's long shift. But we have to pick this up. Temperature checking will add to that. I'm not saying that on its own, but it's an additional measure, along with increased cleaning, enhanced cleaning facilities. If you think that there's been an outbreak, you think somebody's symptomatic, you need to think about cleaning where they've been, those contact areas. Overlapping of shifts, that's where I've seen a lot of it over at the airport. The shift patterns, some of them overlap. You're increasing that risk. It's bringing that control back in. Review your rest periods, the break periods. Don't let a whole shift go on a break at the same time. The canteen might be big enough under normal circumstances, but you need to try to distance them. So maybe you need to think about splitting those shifts, focusing on minimum number of people where possible. And on a final note on this, the concept of COVID secure, I think there's lots of new brochures that are coming out on mental well-being. When something goes on for such a long period of time, or people get overwhelmed with the amount of information they're being fed, or they're being told one thing and then we have to change that. We have to focus on their mental well-being, their stress levels. Think about your staff, think about what you can do to support them. And again, as a chamber, we have an awful lot of information on this. Speak to Sally, speak to Alan, come back to us with some questions if you've got them, but there is information there that we can pass on to you and support you with that. Think about your business itself. Is it an essential or a non-essential business? Difficult one, as Kelly again touched on. There's a grey area. Some of the legislation is a bit woolly, but I'm going to leave Graham to do that one. I'll stick to the black and white, what we can do for a risk assessment. I'll hand over to Graham shortly on that. Knowing what your legal obligations are, your communication with employees, that's the same whether we are in a pandemic or not. Providing your staff with the information they need to keep them, their colleagues, their family safe. I've mentioned the risk assessments for the workplace itself. The working from home, again, another really important factor. And hands up, I wasn't very good at making sure Sally's was in the beginning when we first went into this, but there are workstation risk assessments that need to be carried out. Need to make sure your staff are safe, be compliant. And if they're coming back to work, are they understanding? We had this, what I called the lockdown syndrome. When people were all locked down, we were told we had this pandemic. Every day we were getting this information. And then we went, okay, lockdown's over, out you come. They hadn't been involved in understanding those control measures and just thought it had gone away. Return to work means communicating with them and letting them understand what new control measures are in place that may not have been in place potentially before they were furloughed. You need to speak to your staff. Social distancing where you can, screens up to protect your staff, additional cleaning. Okay, I think I've probably bored you all with the health and safety side of this enough now, but I'm here. I have been working all the way through. I am available. If you need to speak to me, go through Sally. I'll do what I can. Like I say, I've worked throughout the whole of the lockdown. I'm seeing this firsthand and I will support you wherever I can. Come through Sally and I'll do what I can. Legislation and guidance is out there. Again, both are slightly different and I'm going to allow Graham to deal with that one for me. So thank you, Sally.
Thank you, Mel. Thank you very much indeed. I think that leads very nicely into to Graham. Graham is the Principal Regulatory Officer at Hounslow Council. Graham, over to you.
Thank you, Sally, and good morning, everyone. Can you hear me all right?
Yes, absolutely loud and clear. Thank you.
Thank you, Sally. As Sally said, I'm a Principal Regulatory Officer with Community Enforcement at the London Borough of Hounslow. Now, in this section, I aim to cover some of the government COVID legislation that authorities are required to enforce. Now, some may say that legislation is a bit of a dry subject, but hopefully I can share a bit of information that will still be of interest to you. I'll also discuss where you can find guidance to help you make some more sense of the regulations, and I will also say a few words on who enforces them. Now, as a regulator, we are concerned primarily with three main sets of COVID regs. There are others, of course, but the bulk of our regulatory efforts are focused on just three. Now, firstly, at comfortably more than 80 pages long, the coronavirus restrictions regulations. These are a real heavyweight, also known as the all tiers regs. They cover considerable ground. Now, this legislation packs a particular punch because it covers many of the rules governing our personal and family life, as well as those affecting businesses during the current lockdown. For instance, in there, you'll find the restrictions on leaving home, together with the reasonable excuses that you can have to do so, details on how to form acceptable linked childcare households, and restrictions on people meeting together outside of home, which are known as gatherings. And obviously, we've seen a lot of that in the media in the last few weeks with illegal raids and what have you. But it also sets out what can and can't be done in the different tiers. So, for instance, in tier 4, which of course we are in, it describes what businesses can remain open. So you'll know many of these, I'm sure, but examples would be food retailers, dry cleaners, garden centres, automatic car washes, to name just a few. Now, it also mentions those that must close. So, for instance, there you've got personal services like massage and nail bars, bookies, and hand car washes. They have to close. So in here, you'll also find the restrictions on certain businesses and services. So an example of that might be that a restaurant can remain open, but only if it provides food for consumption off the premises. In other words, takeaways.
Sorry, Graham, just to interrupt, are you able to turn your camera on?
Or is your I'm not sure. Yeah, I'm not sure I can, Sally.
Okay, I think Lisa asked you to. Yeah, you have to press yes, but no worries if you can't. Don't worry. Sorry to interrupt.
All right, sorry, that's fine. Yeah, so takeaways can be sold between 5 a.m. and 11 o'clock in the evening, but they actually could continue to provide deliveries after 11, provided orders were taken by the phone or on the internet. So it gets into the detail of the restrictions. Now we turn to two slightly smaller sets of legislation. Now, face coverings have rarely been out of the news lately. And if you wish to get a clear understanding of where and when you should be wearing a face covering, you'll need to refer to the imaginatively named wearing of face coverings in a relevant place regs. Now, these describe where you can wear a face covering. I'm sure you'll know all these. The examples would be shops and shopping centres, banks and post offices. But it also explains the reasonable excuses that people can have for not wearing one. Examples might be a child under 11, an employee acting in the course of employment, or because a person has a health condition or has some sort of lack of capacity. It also sets out the offences and penalties, such as fixed penalty notices that can be served on individuals who fail to wear one. Then there are the obligations of undertakings regulations. These are a modest regulations in terms of quantity. It's only a few pages long, but they're important because they require you to either display a note as a business. It requires you to either display a notice in a conspicuous location to inform or remind people to wear a face covering inside, or to take other measures to inform them. For instance, some stores are having a security person at the entrance to talk to customers as they enter, or they might make announcements over some sort of intercom or tannoy. Now, just to say that for ourselves as the local authority, we also have the local authority enforcement powers regs, which we refer to. And effectively, these are authorising the local authority to serve things like improvement notices and restriction notices on businesses who are failing to comply with the all tiers regs. Now, this legislation is often quite technical and sometimes difficult to follow. So the government provide guidance. I'll discuss that with you in a moment. And just to say that all the legislation, or the legislation I mentioned above, it's all available on the website legislation.gov.uk. Now, in terms of guidance and support and information for businesses, The go-to website really is the gov.uk/coronavirus. So here you'll find guidance and support for businesses, including travel, track and trace, infection control, financial support, a whole gamut. And there's also a specific relevant sector COVID guidance, such as guidance for offices, for instance. So that one would be titled Working Safely During COVID-19 in Offices and Contact Centres. But there's also guidance for shops and branches and for hospitality and close contact services. So that's really is a good place to go for guidance. You also might look at the web pages for the Department for Business, Energy and Industrial Strategy. You might be familiar with them if you were preparing for Brexit. So this highlights when new or updated guidance is available. So it's worth contacting them for notifications when they update the website. And you might get, for instance, there an overview of how you apply for employees' wages through the job retention scheme. And there's links to much more than that. I'd also recommend the HSE, the Health and Safety Executive web pages. They have their own coronavirus pages with advice and guidance on how to carry out a COVID risk assessment, for instance. So Mel mentioned that, what a challenge it is for business to create a COVID risk assessment. But if you do want direction on how to carry one out, the HSE guidance is particularly worth looking at. It goes into a sensible level of detail, but it also covers all key areas, and even gets into areas like people's mental health and well-being, and display screen equipment whilst people work from home. So that's well worth looking out for. Just a note on the guidance. Regulatory bodies would generally see following the guidance as a business complying with the regs. Now, you couldn't say that will be always the case, but broadly, if a business is following the guidance in these coronavirus in the government's coronavirus pages, we would see that as you won't go far wrong. In terms of who's responsible for enforcement, well, as a general rule, the local authority is responsible for enforcing legislation that affects businesses, and the police enforce that which affects individuals. So if you look at us in the local authority, first of all, for the oil tiers regulations, well, obviously we're going to be sort of enforcing the aspects about restrictions and closures. And for the obligations of undertakings regulations, we would be looking at the businesses displaying, shops, etc., displaying the notice on wearing a face covering. Indeed, our officers have been visiting businesses that have failed to display such a notice, and they have been serving FPNs where they felt that appropriate. That leaves then the police, who also enforce aspects of the all tiers regulations. So these are the ones concerned with individuals, so people leaving home or gathering outside. And also they'd be responsible for enforcing the wearing of face coverings in different places, because it's individuals who will be going through the shops, and so the police have the interest there. Mel mentioned the COVID marshals, which some of you may have met come into your business or your store. They are required that their job is really to give guidance and to engage with business owners. That's a service provided through the Chamber of Commerce, and I stress that they're not regulators. They offer information, but they will also feedback to enforcement if they find any businesses that are sort of well short of where they should be with regard to their COVID measures. So in summary, you have the all tiers regulations, the face coverings in a relevant place, and the obligations of undertakings, all worth getting across really, so you understand your responsibilities as a business. So thank you very much for your attention, and I look forward to taking any questions at the end. Thank you.
Thank you very much indeed, Graham. Thank you. That leads on very nicely to Alan Rides, RMD, who can say a few words about the work the Chamber's been doing with the Council on the COVID-19 marshals. Alan, over to you.
Hello, everybody. Good morning. Thank you very much for mentioning the commitment to business, energy, industrial strategy. It was only last year, in fact, the year before last, that our Chamber was in Parliament receiving an award from BASE of the services that we give. And we work very closely with local businesses, small and large, for the benefit of the local community, to improve the economy, linking them in with the major players in the borough, starting with the council, moving out to GSK and Heathrow Airport. And that's transformed over the last 6-9 months now to being able to, with the huge assistance from Mel, delivering a wonderful service for Safer Business Hounslow to help the borough not just be a bit more crime safe, but to be a lot more COVID secure, which we're very proud to be. Perhaps I could ask the first question, Sally, as I'm the last one on the podium, so to speak. I think I got a nod then. This question is really the difference between the first phase and the second phase and the virus that we've had. We saw in Hounslow that numbers in our borough were a lot lower than the rest of the country in the first lockdown. But the second lockdown, our numbers have gone through the roof. But we've also not just seen that in Hounslow, we've seen it internationally, where Germany wasn't really affected in the first lockdown, but the second lockdown, they've been hit at least as badly as the UK. I know we're not supposed to be comparing us with them, so to speak, but can you tell us a little bit about what the difference is in the strains that have happened since the first lockdown and the second lockdown? And more importantly, perhaps, how the Chamber of Commerce can try to get a better message out to stop this negative publicity in social media that's precluding a lot of people from the BAME section of our society from stepping up and taking this vaccine. That question was both to Kelly, I guess, and to Mark.
Yeah, should I? Well, I'll start, and I just so the difference. Well, the starting point is a pandemics come in waves, and we've seen that all the way through various pandemics that we've had over the course of history, sort of that have been recorded. So if you look back at 1918-19, second wave was much worse than the first wave, but the difference here is that. Obviously, the first wave lockdown was essentially when we first identified, we were at a sort of a standing start. So we could, while we didn't have community testing in place, we could essentially see the sort of the increase in numbers, and particularly we're able to see sort of the impact of hospitals. And if Mark were here, what he would say was that actually a lot of people did die in the first wave because actually it was very difficult to, in the same way as you identify a new medical illness or a new any kind of infection, the medical community work their way around how do you deal with it. So this kind of second wave, what has brought is actually, the use of dexamethasone has meant that fewer people are ventilated, and the general way that the hospitals and community services have mobilized in response to flexing sort of the training of staff and to increase the number of staff that are able to manage people who are critically unwell. What we are seeing this time, though, is such a huge number of people, and hospitals are finite resources, and so in many respects there is a lot of there has to be a much greater coordination of the way the system responds, and a lot more people have had to step up in terms of in the community in order to keep people safely within the community, so that only the very, very unwell go into hospital. But the real difference is the this variance. So what we've seen over the course of this pandemic is this kind of roller coaster of activity. So if your numbers become really high, this reproductive, this R number, and if people don't comply with these kind of hands, face, and space, the opportunity for transmission is massive. So an R number of being 1 is that one person infects another person. That's all it is. But actually what we're seeing, because in households, one person, which we call the index case, will infect the rest of the house. Okay, so suddenly you've got, you know, within some families, large numbers of people living together. So one person can actually infect sort of 5 or 6 others. So, you know, that's massive amounts. So that's why the sort of the rules say stay at home, only socialize within your households. But the regulations in terms of lockdown has changed. You know, the clinics are extremely vulnerable, were isolating and have been isolating for a long period of time. People were definitely more compliant with the first lockdown. But I have to say, and I remember looking back at sort of March, particularly after the sort of the information that was coming out of Italy, they were very clear, this research that says you've only got one chance of lockdown in terms of real compliance, one chance. Now we're on to our third one now. So, you know, if the research was back there was saying that was coming out of Italy and Spain, saying you've got one go at this that people will comply with, and suddenly we're now on third. It's not surprising that people are fatigued by this. So generally there is a sort of a degree of people not always following the rules, and perhaps actually, you know, we're not talking about the majority, because the majority do, but it only takes a very small number to create this kind of massive amount of numbers. But this difference in transmissibility of this new variant. And as I said, you know, 76% of the new cases that we're seeing is this new, much more transmissible variant. And actually that's really problematic. And again, you know, we are regularly testing, for example, in care homes, but actually by the time you get the test results, more people have been affected by it. So it is constantly on your back foot. So, you know, we do anticipate this, and I think, you know, the lockdown it could have come earlier, but we are where we are. So the important thing is that before we come out of any lockdown, there is a really clear strategy about it. You know, what is the threshold by which we come out of lockdown? Will this R number be really low? Will the rates will need to be low? Because actually, in terms of that sort of impact of the lockdown in November into December, we saw such minimal impact that actually by the time we started off sort of with this identification of the new variants, we were escalating with exponential growth very, very rapidly. So our pandemic curve of cases is incredibly steep. In terms of BAME communities, and I would really, really, you know, encourage sort of any type of engagement with these communities. We know from the data, from Public Health England data, that these are the communities that have been most adversely affected, and they're adversely affected because they are more likely to get infected. And that's not because they are somehow predisposed to it. It is because they are in front-facing jobs. If you're out and about and you're not able to stay at home, you are dealing with numbers of people within the community. If you're in a care job, a security job, or a taxi driver, or any kind of logistics driver, or a key worker in a shop, you are more likely to be in contact with more people than if you stay at home. So predominantly, many of our BAME communities are working in those kind of environments. The more that you put people into those environments, the more likely they are to get infected. And the more likely, if they're certainly within an older population, you know, they are more likely to be hospitalized. So that's where the difference really is. So actually, when anyone becomes unwell, regardless of which ethnicity or which community group they are, if they are really unwell, they need to go get GP and hospital support where required as soon as possible, and that is key. And when they are offered a vaccination, they need to accept it. Did I cover? I think there's probably some. Is there any more sort of parts of that, Alan? Because your question was multifactored.
It was a broad-ranging question, yes, but it was you did cover all of it, the local cases, the international cases, but more how can we help get the message across to the BAME community, especially, who seem to be hearing the messages, the terrible messages on social media about bad reactions that people have had, that frankly are largely false, that's out there in social media, and how do we help counter that?
Do you know what, Alan? The key thing about that is that you need to go to credible sources, and there are lots of credible sources out there. But for some strange reason, people like to listen to any old person who's got any negative thing to say with no research to back it up. Listen to the doctors, listen to the scientists. These people are in those positions for a reason, not the woman down the road who might have occasionally have had a bad reaction to something. Some people will have a bad reaction, but they're very few and far between, but they'll be very vocal about it. So actually listen to the people then that know, they've spent years studying it.
I very much remember Van Tam talking about his mother being the first at the queue to get her injection, and then actually the press following his mother into the vaccination centre and actually seeing her being vaccinated, which was good to see.
I'm aware of the time, and we have got a burning question from Bridget from the Rotary Club. Rotarians are very keen to volunteer, but she has a question about insurance. So maybe this is one for Mel and Kelly. Who's responsible for doing this risk assessment? I mean, she was talking about the NHS and the local authority, and they would like to volunteer to help with vaccination centres and asymptomatic testing, etc. So, yeah, Mel, do you want to go for this first, or Kelly?
Okay, Kelly will be better probably on the legal bit. I can do the bit that might be a little bit woolly. I think I can see Bridget's questions there. I think if I was just to kind of sum the whole thing up, I think there was a sentence that was said at one of our meetings that I was involved with the council a couple of weeks ago, and I've led everything by it. It's in the spirit of the legislation. We have to go back to what we're trying to achieve here. And Kelly has quite rightly said, the more people that are infected and the more people you're in contact with, the more chances are you are going to become poorly and you are going to pass it on. We all have to do what we need to do, whether it is above and beyond your responsibility, because I can see that in the question. Legally, there is one side. Against the legalities, in the spirit of the legislation, we want to bring that R rate down and we want to stop people dying. I believe everybody has a responsibility to complete a risk assessment, to look at who's at risk, consider the control measures. I think when you're talking about volunteers, you have to look at what they are going to be doing, how they are covered maybe on your insurance. If they're driving around, they need to look at their own car insurance. I think, again, it is one of these things, it's not somebody else's responsibility. And health and safety is always like that. You've got the employer, you've got the employee, you've got everyone. There is no one person that is responsible for health and safety under normal conditions. And this is just more important that we make sure we all step up and do that. And I think that's kind of my side of it. On the legal, a little bit more woolly, I'll let Kelly jump in.
Yeah, I mean, I think Bridget's comment about helping out at the Rotary Club, helping out in sort of various locations. I think that there is something about their sort of individual sort of self risk assessment, but I think that given that the NHS is responsible for vaccinations clinics and we are responsible for mass testing, I think we do need to do a risk assessment to determine what risk this is to volunteers. I know they are both very, very tightly regulated in terms of testing of staff that go into these sites and the infection prevention and control. But yeah, I think it is fair to say that I think we need to look into this, but do so quickly, because we are about to get these mass vaccination centres up and running from February. So Bridget, I have received an email from you, I think, which is along those lines, and I will definitely look into it.
Lovely, thank you very much. And I just have one last question, a very simple question. Some people aren't showing up for their vaccinations. Do you have sort of like a waiting list or a short list of people who live near to the vaccination centre who could then just be called to say, we've got some available, get yourself down here? Does that happen?
Yeah. So that's exactly what does happen, is that there is always a waiting list. So we have allocated vaccinations based on the batches that we get. We get batches of 975, but we've realized that actually you can get more out of a batch of 975. So we have a list of people who are, 975 people that we anticipate with a few reserves, but we also have this waiting list. And sometimes, that includes some of the health and social care staff who will be called, and these are the ones that are eligible to be vaccinated, and they will be called at short notice if there is some a vaccination that's available that needs using up, because they have very, very once they're defrosted, particularly the Pfizer one, it has to be used there and then. You can't store it, and the absolutely essential and moral thing is to make sure that there is no wastage. And so far, certainly in Hounslow, there hasn't been any wastage.
And sorry, another final question. My final questions keep on coming, don't they? What about the gap between the vaccines? Does the AstraZeneca one need 2 injections as well as the Pfizer one?
Both of them need 2 injections between 21 and 28 days. That's the manufacturing license. Obviously, as you'll know, the government moved the gap between the doses up into 12 weeks. Now, from a public health perspective, given our high rates of infection, protecting, if you've got 100 vaccinations, protecting 100 people partially is better than protecting 50 people fully and 50 people with nothing. Although it is very clear from the medical community, the British Medical Association, that they want a review of that time frame, and sort of thinking to, the general view is that for them, that they haven't seen the evidence to say why 12 weeks was chosen. They would want to see that gap reduced to 6 weeks. I think that should be left up to the Joint Committee for Vaccination and Immunisation in discussion with the British Medical Association, but actually needs to be left for the scientists and the doctors to decide what is the best or what is the safest gap between the two. But actually, in terms of a public health response, vaccinating as many people as possible to reduce the symptoms so that fewer people are hospitalised is an absolutely essential approach.
Lovely, thank you very much. I think that we're now at 4 minutes past 12.
Sally, I just think there's one attendee that has got a hand up. I don't know if we want to just.
Okay, what's the question? Sorry, hun.
No, they've got their hand up. Has one of our attendees put their hand up? Do they have a question for us?
Okay, Lisa, can we get that person's question?
While you wait, there is a question from Bridget that can I just take the liberty of answering. Yeah. There is a question of why is asymptomatic testing important? You would not believe how important it is. One is that 1 in 3 people are asymptomatically carrying the infection, and they will be passing it on. If they don't know about it and nobody else knows about it, more people are going to be infected. From a population health basis, the more that people that we can identify who are infectious, and remember this is about serial testing, it's not one-off, and put them into isolation or encourage them into isolation, support them to do so, the more likely we are to reduce these rates of infection. So it's incredibly important.
Thank you very much.
Thank you for indulging me.
No worries. We've got Jag Segura, who's. Do you want to turn your camera and unmute yourself?
Yeah, 1 second. Oh, can you hear me?
Yep, yeah, I can hear you.
Oh, I don't know if the camera's not on. I don't know if it is on, but it says it's on. But anyway, thank you for organising this. This has been amazing, Sally and Alan. Just a couple of quick observations. In terms of this roaming vehicle, is it also going to construction sites? Because obviously Hounslow's got a lot of construction going on.
Yeah, so we have predominantly focused initially, because we've only got 2 of them, on inside businesses, because inside businesses are greater risk than construction sites in general if it's an outdoors. But actually, as we build up our capacity to be able to do mobile testing, then we will start sending it to sort of the wider groups. But we haven't advertised it too much because we've got quite a demand for it. But what I would say, and looking out of Hounslow House window now, we have got a testing site right downstairs, and there are quite a few construction sites around here. So there is the static sites, of which there are 4, about to be 5, that would welcome people to sort of turning up and getting tested.
Perfect. And the other thing was, yesterday on the BBC, there was a virologist, I think it's called, if I haven't got that right, who sort of contradicted a public health message, which was about airing your homes, like keeping, air coming in and out. And they talked about germs and shopping and everything else. And he said, oh, no, it's good to keep your house warm because it reduces the risk of COVID. And I thought, hold on. The message has been to actually do the opposite. Now, which one is it? Should we be airing or should we be keeping them warm? Because you can't do both. So I was really confused. And I thought, wow. And I've been keeping very close contact with all the messaging. And I thought, if I'm confused, this is going to add a lot of. He's on the BBC yesterday morning, really confused me. But can you shed any light on that?
Well, I hasten to add, I'm not a virologist by background. But what I would say is that a single view probably doesn't always correspond to what the right guidance is. So I would advise that people follow the view that is taken by SAGE, independent SAGE, that actually airing your house and sort of allowing a throughput of air is probably better than keeping your house nice and warm. But equally, the key thing is that viruses do like lots of people in the same room together. So, you know, while airing your house is really important and trying to keep this throughput of air going through, if too many people are congregating in the same place, it's going to have minimal impact in terms of reducing spread.
Okay, no, that's brilliant. And just one observation, which was about HMO properties, something which I've raised with Ealing and most probably Hounslow and Hillingdon. The amount of HMOs that we have in the boroughs are way above anywhere else in other parts of the country. They've got to be contributing to these problems in these boroughs, because even the ones that are licensed and all the ones that are unlicensed and illegal are most probably. And I know, speaking to community leaders, a lot of those people who are residing in the illegal ones are not coming forward for testing because they're scared their immigration status may be compromised, though they're working, and they don't want to go in. So this is a major problem in the boroughs of West London. I don't know if you guys are aware or dealing with it in a different way, but I'm sure you're aware. But
yeah, so we've done a lot of work with HMOs, but it goes back to that old Rumsfeldian thing. There are known HMOs and there are some HMOs we don't know about. Where we do know about them, we've done a lot of work and we do follow them up, and we have regular contact with them, and we have dedicated officers who liaise with them. It's the ones we don't know. So if anybody does know about HMOs that you know appear to be under the radar, this is not about being punitive. This is not about flagging up. This is purely from a public health perspective in terms of infection prevention and control. If we don't know about them, we can't do anything with them. If we do know about them, we can support them. This is not, you know, I really would hasten to add, this is about the welfare of the individuals who live there. The rest of it can take second place.
Thank you, Mel. Thank you, everyone. It's been a great session.
Thanks, Jags. I think we've got one more hand. Have we got time for one more? Yeah, Lisa, can we bring Ash in?
Hi, good morning. Can everyone hear me?
Yes, we can hear you, Ash.
Yeah, we can hear you.
Hi, Alan, Sally, thanks for this. Kelly, probably a question for you. All these vaccinations and testing are all being rolled out now. Does the council have some sort of a statistic in a hope for us to timeline when all this thing will come to a sort of end from this madness? So I know it's a hard question, but from a local perspective, you already have some data from the last 10 to 11 months since the lockdown first started. Now you're rolling out these testing centers, number of them have increased or increasing. Can you feed in some sense of hope and in terms of timeline when this madness can be reduced from your statistic and data?
Yeah, there are so many factors that contribute to this that it almost becomes sort of a little bit, it's a bit like modeling data. Modeling data is only so good as it's academic. What we do know, and what is quite clear, is that testing, for example, just allows us to be able to respond to it and to be, you know, proactively get or respond to people and get them into isolation as soon as possible. Vaccination is the way out. So if you think about, you know, what contributes to infection spread, one is that people congregating, not following the rules, people meeting up in places, people in enclosed settings. All of those factors make it very, very easy for a virus to spread, very easy. Testing will allow us to identify them and get those people into isolation where they get tested, as we know that many people are not getting tested. And we have lots of capacity in the borough of asymptomatic testing that is not being used at the moment. And it's such a shame, because actually that's the means by which we get out of it. What we do know is that the vaccination program, you know, the 4 priority groups will be done by the middle of February. That will have an impact on the hospital, not immediately, but in the short term. As we go through the summer, we know that COVID doesn't like sort of warmer weather. We know that people will be out and about a little bit more. So what we are likely to see is the infection rate dropping and probably dropping quite considerably when that warmer weather happens. A bit like what was going on between sort of June, July, August and September this year. So you can expect that with these new variants that come in, whether it's the Essex one or the Brazil one or the South African one, and there'll be more, or the Danish one, and there'll be more. It depends on what the impact of those variants are and our ability to respond to them quickly, and how effective the vaccine is going to be with those newly emerging variances. And the flu virus is a typical one. We have to get vaccinated every year because the strain changes. The chief medical officer has already identified that come next year we might be in a different place in terms of having to change the ingredients on these new COVID vaccinations to be able to respond to the new variants. I think it is difficult to think actually, when is this going to stop? Because actually, in many respects, it may be ongoing, and we just may have to adapt and learn how to live with this.
Yeah, thank you. Thanks.
So sorry, I haven't answered it, but it would require me to be to put so many factors together and to try and come up with a really good calculation. And I would be disingenuous if I suggested anything else other than what I've responded.
Yeah, perfect. Thanks for that, Kelly. Thanks, guys.
Thank you, Ash. Thank you. I'm not able to see any hands up at all, Mel. So I need
No, there's nobody else with a hand up. We're fine.
Okay. Thank you so much, everybody, for being with us today, for giving up your time. To Kelly, to Graham, to Mel, and to Alan. Mark obviously had to go. I'm sure that Bridget from the Rotary Club, I'm sure that Kelly will be in touch with you about that. Thank you very much indeed. Keep safe. And we very much look forward to seeing you on the 4th of February when we're having an international trade webinar. All right. Thank you very much indeed. Take care. Keep safe.
Thanks, everybody. Bye-bye.
Bye, everyone. Bye-bye.